A new study published in the Journal of Pediatrics found children who drink a lot of soft drinks have increased aggression, withdrawal, and attention problems. This is the first time researchers have looked at a group this young. 3,000 5-year-olds from 20 large American cities were involved in this study. 43% of the children consumed at least one serving of pop per day. 4% consumed 4 or more servings each day. Those children were more than twice as likely to destroy others' belongings, get into fights, and physically attack people. They also had increased attention problems and withdrawal behavior. Our health specialist, Dr. Ali Zettner, is here to break this down for us. What are the implications of this study? What should parents be concerned about?
So we knew that, for example, sugared sweetened beverages affected older children, ages, let's say, we had data on 10 to 18. We have some interesting data in the adult population about sugared sweetened beverages and health implications. What this suggests is that there's no good time to start feeding a child, so to speak, sugared sweetened beverages. And what I think the biggest implication about this study is the behavioral effects, not just sort of the increased risk of obesity, the increased risk of hypertension and diabetes later on in life, but the immediate effects of feeding a kid sugared sweetened beverages now.
What about the specific ingredients? Is it more the sugar or is it the caffeine?
You know, I would argue it's more the sugar, and in fact we have great data showing that giving a kid sugared sweetened beverages, it's the refined sugar and the high fructose corn syrup, for example, increases certain behavioral tendencies and increased withdrawal and increased aggression. More importantly, we have PET scans and functional MRIs that show what the cause of that really is. But I don't think we can tease out exactly the chemical relationship. So what I often wonder is there other implications here? Is it a cause or sort of an environment that you put a kid in that you might feed it pop more, for example?
What about fruit juice? Is it any better?
So in this study, they also looked at fruit juice, and what was fascinating about this study is they actually controlled for socioeconomic status. They controlled for other sort of what we call food insecurity, so fast food conveniences, etc., and found that this was an isolated feature. In the fruit juice group, so one serving of fruit juice absolutely had almost a similar effect to one serving of pop.
We know that the Americans tend to consume more pop, and the study was based in the States, but what about Canada?
You know, Canadians, God love us, and I'm a staunch Canadian myself, but we often try to say, oh, we're absolutely different than the Americans. Some of the data we have from Canadian health surveys show that we absolutely consume about, a third of us consume at least one serving of sugar-sweetened beverages per day, and that's no different in the younger population. We have data on ages 3 to 13. We don't have necessarily 0 to 5. But I would always argue that when we try and separate ourselves from the Americans so closely about our nutrition, I usually say just understand that we're probably a decade behind.
Finally, quickly, what are the health guidelines when it comes to these drinks?
So less than 10 grams of refined sugar per day for kids. Absolutely. I would argue fruit is fine. Fruit juice is off the menu from now on. We shouldn't be feeding our kids refined sugar to the extent that we are.
All right, Dr. Ali, thanks so much.
Thank you.